You ultimately voted to confirm RFK Jr. As secretary, and then you also recently cleared the way for Erica Schwartz's confirmation as CDC director. Do you regret those decisions?
Well, so first, this is a presidential executive order. RFK told me he was not going to change the ACIP. So if you want to tell me somebody didn't tell me the truth and I should have seen in the future that they were not going to tell the truth, you can say, oh, Bill, you should have seen into the future, in which case I'd be on your show talking about the futures of stocks as opposed to vaccine policy.
Yeah, that was Republican Senator Bill Cassidy on CNBC yesterday. Cassidy cast what was essentially the deciding vote to confirm Robert F. Kennedy Jr. as Health and Human Services Secretary last year. And now the Louisiana lawmaker is criticizing President Trump's recent executive order that significantly scales back federal childhood immunization recommendations. And joining us now, Dr. Jerome Adams. He served as Surgeon General during the first Trump administration and has also publicly criticized the president's executive order on childhood vaccine recommendations. Dr. Adams, I'm just wondering what crossed your mind when you heard that executive order being announced.
Well, I was shocked, and I was shocked because of the timing. You literally just last week had a new study released of 2.5 million children when they looked at whether or not the MMR vaccine was correlated with higher autism rates in children between the ages of 1 and 2, and they found no correlation. Again, on timing, you have record measles cases, the highest number of cases in 35 years, and people will say, well, so what, a couple more measles cases. The cost to investigate each case is around $40,000. So we've spent over $100 million in this outbreak investigating measles. You've had tens of thousands of days of kids missing school and inconvenience to parents. But I want to be really clear what the EO doesn't do. It doesn't remove the MMR combination vaccine from the U.S. market. It does not by itself change what pediatricians administer or can administer in their offices right now. And it does not change or immediately override the recommendations of major medical organizations. But it does make vaccinations more complicated, more expensive, and easier to delay or to miss by parents.
During that executive order announcement, the president said a lot of things. I'm sure you've seen it. I'm just wondering, was he spreading misinformation to the American people?
Well, there were a lot of things said during that press conference for the EO that are not supported by the scientific evidence. And what I took from that is that the president is getting bad advice. I've actually had the honor of working with several presidents, 3 different governors for the state of Indiana, and you can't know everything about everything, and most of them know very little about health. You rely on your advisors. And in the first administration, he was surrounded by advisors who supported the science as we know it. And in turn, he led Operation Warp Speed. I've said before, I believe the president should have gotten the Nobel Prize for creating vaccines in record time. I actually was looking at a picture that popped up on my phone where we were all together, myself, the CDC director, the FDA director, and Alex Azar, our HHS secretary, supporting flu vaccinations. You're not seeing that now. You've got an advisor who ran the world's largest organization spreading vaccine misinformation for a decade before he became HHS secretary, whispering in the president's ear. And the president, and I do want to say this, parents out there, I don't blame or shame any parent who has questions. And I think what the president is doing is channeling many of those questions he's hearing from the public. But there's nothing wrong with that. But if you have good people around you saying, well, here's the context, here's the information that the science shows us about whether or not we should be changing policy, then you hope the president will make a wise decision. But I think he's saying these things because he's hearing them from RFK.
So, Dr. Adams, you just touted the successes of Operation Warp Speed and some of the Trump administration's COVID response. Well, a big part of that was Dr. Anthony Fauci. But yet, in the last 2 weeks, we saw his diary put out for the world to see and have him hauled before Congress for a very antagonistic hearing and now potentially criminal charges. That seems to be, what Republicans right now, or at least a segment of them, are concerned about when they think about the nation's health. How damaging is that to other medical professionals who are in a time of crisis, like Dr. Fauci did, like you did, trying their best and trying to sort of adapt to a changing, brand new situation?
Well, I'm glad you landed where you did on that, because it's certainly a charged political discussion. And again, many people are rightfully asking questions about what caused the pandemic. But that said, I am deeply concerned about how we are demonizing, attacking people in public health, lowering trust in public health officials through actions of our federal elected representatives. And it's having a chilling effect on my colleagues. People are choosing not to go into public health. They're retiring from public health. And what are you seeing? You're in turn seeing less and less capacity, along with the DOJ cuts and everything else that's going on at HHS. And that's turning into 10,000 plus cyclospora cases. That's turning into salmonella cases. That's turning into E. coli and listeria cases. And so when you attack public health, both the people and the capacity, then you reap what you sow. And we're seeing, again, record infectious disease outbreaks in many cases because of these attacks. And so I wanted to connect those dots for people, because it's important to know this isn't just about attacking one person. It's about attacking all of our public health response capacity.
Former Surgeon General, Dr. Jerome Adams. Doctor, thank you for joining us this morning.
Thank you.
And Mara, we heard from the doctor there, used to work for President Trump. We can look at the statistics. We can look at the outbreaks and the numbers that go with them. It is impossible to argue that, that this nation is healthier today than it was the day President Trump took office for the second term.
No, it's striking. And I'm so glad that we had the former Surgeon General on, who, of course, was a Trump appointee. And it's remarkable that we would go as a nation from having Donald Trump oversee the rapid and life-saving vaccination of millions of Americans and embrace that, to just several years later, now we have measles outbreaks of diseases that have been eradicated in the Western world simply because Trump 2.0 has embraced disinformation on science and anti-science movements. I think it's tragic.